mechanisms of injury for the rotator cuff syndrome. Most common is going to be overuse. We were already alluding to athletes, so baseball players, basketball players, those with kind of ball sports. Those are going to be frequent to show up for rotator cuff syndromes. Also, think of kind of like the weekend warrior, somebody that goes from, we're in February now, if we jump in that to that really first nice day of March, and everybody goes out and hits the parks and starts to play pickup games of basketball or whatnot, that can definitely be an elicitor of a rotator cuff syndrome going from 0 to 60 way too fast. Also, we are concerned about falls, not so much for the fall and landing on the shoulder. That's more kind of like an AC joint type of injury, but we're worried about as somebody falls and they go to grab like a chair on their way down to break their fall, or landing on that outstretched hand and jamming that shoulder back up. That's kind of more the concerns of something that can create a partial tear or of micro tearing or inflammation, irritation on that supraspinatus muscle or the rest of the rotator cuff bundle. And then poor posture. If somebody's kind of sitting at the computer here all day at work and they're having that head hunched forward and the shoulder rounded forward, that's just going to keep that chronic strain on the rotator cuff group, and that in time can lead to pain and elicit an inflammatory irritation response. That one especially is going to be more like the chronic version of the rotator cuff syndrome, where the patient comes in and says, "Hey, I'm not really sure why that happened, and I didn't have an obvious injury that caused this pain." Well, it's just a lifestyle, chronic posture, poor posture situation that's driving the pain.